fly, know that they ride or die. I keep waves by my side, CJ Ike, now I gotta roll with ice. Cold, these brothers my guys, know that they fly, know that they ride or die. I keep waves by my side, CJ Ike, now I gotta roll with ice. Ride or die, 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 ride or die. Cold, these brothers my guys, know that they fly, know that they ride or die. I keep waves by my side, CJ Ike, now I gotta ride or die.
Y'all ready for this? Yeah.
This is the Lisa Baxter Show, giving you the 411 and the kidney one. My girl, and say, this is. I'm trying to. They said I gotta use that cane all the time, but I don't want to use the cane. But I think I could do this myself if they just give me a chance and stop judging me. All right, I broke my arm before, and I slipped again. And I got bruises on my feet and legs. I didn't want to do this, but, you know, sometimes you just got to give in. There's my cane. You happy? All of y'all happy? Now go in your rooms because I'm going to look at my show now because this is the Lisa Baxter Show, giving you the 411 in the kidney world. Hi, guys. Happy Sunday and welcome to the show. I love you guys. You guys are wonderful and you rock. Oh, man, I went to a wonderful event this week and it was at the door. It's called Health and Wealth, but they had a floor with everything. One floor, a dialysis center, a senior program, and a medical program. Excellent, and give blood fusion. They had an English on one side and Spanish on the other. See some of those resources that I put out there on my page. Now, I don't even drink, but they gave me this kit. Isn't that sweet? And it's so cute. I had to show you guys. Oh, look at it. I know my family going to steal it because I don't drink, and there's something, I guess, dealing with drinking. But I just like the box and everything and how pretty it is. So I was grateful and I was thankful. If your mouth get dry and you know you're on dialysis and you can't drink so much, try chewing some gum, some sugarless gum. That is extremely and very, very helpful. If you know you are moving, then you know to fill out the form so they'll know your new address. Okay? So thank you very much. And if you are making your own lunch or something to take to work with you, this is very good for that. It has the knife and fork and everything already. And you have 2 compartments that you can put the food in. How about that? I done told you. I done told you. So let me talk to you and tell you about my guest. Yes, this lady is military. She's a physical therapist. She's sweet. And everything like that, all of that rolled up together. Oh my goodness. Her name is Patricia. Well, I was calling her Patty, but that's what my niece calls her. Patty Beers. Patricia Lamas Beers. I'm going to welcome her to the Lisa Baxter Show, and she's going to tell you her story. Welcome, Patty. Welcome.
Well, hello, Lisa.
Hi, Patty. How are you?
Well, I'm great. Thank you so much for having me on your show. I feel very lucky and I'm super excited.
Well, I'm definitely glad to have you. I tried so long to get a dentist, a GYN, all kind of things, a radiologist, but I got the physical therapist. I didn't get the pharmacist yet, but I'm shopping around. So thank you so much for doing this. My niece Remerthea Webster,
Yes.
Dr. Webster, my niece
Yes.
told me about you and you just did it. So you didn't know me from Adam or a can of paint and you said yes. So I do appreciate and thank you for that.
Well, thank you. So like you said, I'm a physical therapist. I've been a physical therapist for 24 years. So I went to school in Nebraska. I'm from the University of Nebraska Medical Center back in 1997. So I've been practicing for quite a while.
Well, that's wonderful. Now, before we get into your profession, did you do anything before you became a physical therapist?
I did not. I knew I wanted to be a therapist since I was in high school, and I just went for it. So I didn't do anything else before that.
Oh, you followed your dream.
Yes.
You went straight to it. You had a passion for it.
I had a passion. Wow. I just went straight for it. I just graduated from high school, went to college, and went right into PT school.
Wow. Okay, so you went to college. This is your passion, and this is what you wanted to do. How did the military fit into all of this before I still get into your physical therapy profession?
So my husband is in the military, and I actually met him when I was already a physical therapist. And so after we got married, then that's how I became involved with the military lifestyle. We've moved 9 times since then. So I've practiced in quite a number of states across the country and currently in Florida. So.
Oh, okay. All right. So you moved around. Okay. All right. So are you military at all or just him?
No, just him. So I consider myself military spouse.
So that's where that came in at. Okay.
Yes.
Oh, all right. Then I understand now because Remerthea is military. All right.
Right, because she's active duty herself. Yes.
Yes. Okay. Yes. So I know you're on vacation and you start back work tomorrow.
Tomorrow.
So I will not keep you out late. This is a hit and get it kind of show tonight. What about that? Okay. So when you're doing what type of physical therapy do you do? If I walked into your office, because I have bone joint disease, I have low calcium. I've dealt with these things because I was on dialysis 12 years and I had low calcium as a kid, and a disc is leaning on my spine and my back. So right now I'm walking with a cane and a walker, which I don't like. But tell me, how do you treat your people when they come in, or what would you do with me if I walked in?
Well, so my specialty has been orthopedics. So I've worked in an outpatient clinic, which is probably where you would go as like an outpatient setting. I'm an orthopedic board certified specialist. So I do work a lot with people who have like osteoporosis and they need to get some weight bearing exercise and get some conditioning going. So I have done that. However, in the last 10 years or so, I've specialized in pelvic health. So, which means that I see a lot of patients with a lot of what you were talking about with your history, women who have issues, and men too, who have issues with urinary incontinence or pelvic pain or pelvic issues. So that's been more of my specialty in the last 10 years. I still do what I did before, but kind of what I've specialized in helping people with those issues, weight bearing exercise, plus helping them with incontinence issues or urinary frequency issues or pelvic issues.
Oh,
very interesting. Did I just surprise you?
That's deep. So I mean, well, do you ever run into any dialysis or transplant patients in your profession or in your, your care?
I do, quite a few actually. I have many patients that when they come to see me, it's because they're having bladder issues. But usually it's not just that, they're also having some back issues and, hip issues. So I kind of consider me someone who can kind of treat all of those things at once, because I can kind of see the whole body, put it together. I take a little bit of a holistic approach, and I try to look at it a little bit from the big picture to address all those things. And so most of what I focus on is to work on exercises. Sorry, I'm getting a little distracted with the icons, trying to talk as I look at those. And so what I do is basically, exercise programs to help people get stronger, know what kind of exercises to do correctly, and not only just exercises for walking and conditioning, but like I said, exercises are going to help improve their bladder control.
Oh, okay. Well, some of us didn't go to the bathroom. I mean, I went to the bathroom the 8 years that I was on dialysis, and the rest that counted up for the 12, I didn't go at all. So when they put the kidney in, I started going. So I didn't have so much problem with that, because I always used to drink a lot, but I couldn't drink a lot while I was on dialysis.
Right.
But okay. So the bone conditions. I'm sorry. No, finish your thought, and I'll go.
For example, I had a patient who came to see me because she was having hip and back pain. But during that time, she was having like bladder issues, but she discovered that she was having kidney failure. And so that was something that from taking a medication, and she didn't know it. And so it was kind of really interesting just to get even someone as they're getting diagnosed with kidney failure and they're going through treatment with me. So.
Wow. So you had to tell her that, or she told you that she had kidney failure?
It was her second visit when she came back, and she said, guess what? I just found out they did a panel on me and I'm going into kidney failure. And it was interesting because she had no idea she was having some bladder problems. So what was good is she was glad that she was kind of learning what to do proactively, because she knew that she was going to be going into dialysis. So she was glad that she could start things before to try to see if she could prevent problems versus, wait until the problem was there.
Wow. Well, did the medication cause that? I heard you mention medication.
Yes, it did. Ooh. She had actually the reason she developed kidney failure was because she had an injury in her back and her hip, and they put her on Mobic. So it was the Mobic, which she took, I think, quite a bit for about a year. And then they just were running some different tests on her. It was because of that she went back, and they told her, oh my gosh, you're in kidney failure. And they suspected it was from the Mobic.
Wow.
Yeah.
That's disheartening. That's terrible. I mean, woo. I mean, you never want to hear the news, no matter if it's your fault or somebody else's fault, the medication, hereditary. Mine was hereditary, but still, that's the last thing you want to hear if you got kidney failure. You know what I mean? And then she's dealing with, I guess, some sort of pain if she's coming to you, getting physical therapy to help her as well. So she's doing more than one treatment. She's going to be doing the dialysis thing and worrying about that, and then doing the physical therapy with you, who's very well equipped. Fantabulous. Right. You know what I mean? So, wow. So what kind of conditions would you name out that deals with the bones, and why should somebody come and see you?
So many conditions that deal with the bones are, for example, if someone's having hip pain, back pain, like we talked about, knee pain, where it's limiting your activity, because most people, what happens, they just do less and less and less because it hurts. So then if they have arthritis, let's say, for example, we have a tendency to want to stop moving. So then you start developing atrophy, your muscles start wasting away, and then you get a little bit weaker. So I think it's really important if people start noticing that they are becoming deconditioned, or they're finding that they're doing less because they're in pain, they really should go see someone to try to help them try to recover some of that, because that kind of makes it worse, because then you get more muscle wasting, and then you get weaker, and then it's just a vicious cycle. And so I always tell people, staying active is very important, but obviously if there's conditions with renal failure, it's important to be under the supervision of your physician, and then in combination of team working with a physical therapist. Wow.
Well, I'm glad you spoke to them and talked to them right. You know what I mean? Your voice sounds soothing. It sounds helpful, because you in such a serious state when they give you these different types of news. Right. You know what I'm saying?
Right.
And it can really, really take you someplace you don't want to go, and you need all the help, love, respect, everything you can get, not just from the family, but from the physicians and
Correct.
the people that's taking care of you. That's the last thing you need, is somebody to be mean or treat you rough, or you know, or give you an off diagnosis.
Right.
So that was a 2-part question, right?
Yes.
All right.
And then the second, and then you were saying, so I think working together with your physician is very important. And then, like I said, and one of the things that we will do, you know, physical therapists will do, is they really will take a look at your history. We'll take a look at, you know, what are some limitations that maybe we have to be careful with. We actually do also take lists of medications so that we can see if maybe there's a side effect of something that might be limiting your participation, and then how we can work around that. And then, like I said, and then just coming up with the appropriate treatment to either address a pain, because maybe that's why someone came to see me, was for a pain, or something that has to do with weakness or balance. Because that's another thing that's very important, is to work on any balance deficits. And then trying, because most people are like, I'm just getting old, so I guess my balance is just going to get bad. And I tell them, no, there's things you can do to slow that process down, because the last thing we want is someone to fall down as a result of a balance issue.
Well, I'm glad you're on top of it. You know, a lot of times, sometimes you feel like an assembly line when you go to some doctors and some places and some physicians and some, I mean, everybody don't treat you this way, but sometimes you run into that time where it's like that. You know what I mean? And they don't know you. They don't act like they know you. Yeah, what's the matter with you? What? Here's the prescription. You know what I mean? And, you know, and sometimes, you know, you might take it and run, and then you might not take it and run, or you saying, you know, but I feel this way. You don't have time to hear how I feel, but I know they have a big caseload. I was a social worker 25 years. I had a big caseload, and sometimes the loads can get heavy, but you do want to give that personal touch too. Yeah,
I agree with you, Lisa. I think that's very important, to take the time to listen to people and try to figure out, like, what's meaningful to them, like what's meaningful to you. Because sometimes as medical providers, we can try to decide, I think this is what you want, but we really need, as a provider, to listen to people and what's important to them, and try to help them to get to where they want to be. But it's all based on listening to the person and working with them so that they feel respected and that you're taking the time. So I'm not a big fan of what you just said, you know, just having a tons of people. I am big into ensuring that I spend time with people. And I think every person who goes to a therapist should definitely, you know, ask for that and expect that. And if they don't, then it's important to say something, because they should be listened to and being taken care of. So I agree with you on that for sure.
Oh, well, thank you. Well, different practices do different things. You know what I mean? Some have that hands-on thing, and some just don't, or some, I guess, hopefully they'll get there or be there at some point. Now, what is your best or successful story, would you say? I mean, not, you know, of a person that came in and you helped or you had to deal with, and you can say, oh my God, she's finally walking or running, or she stood up, you know, some maybe big baby steps. It don't have to be something big all the time, but something that you and the person, you and the patient maybe felt good about that the person wasn't doing before.
Right. I had, does it have to be a specific person, a type of patient that has a certain diagnosis, or does it matter?
No, it's your success. So whatever they fall under is you.
Okay. You know. So most recently, and this is right before I moved, I had a patient, probably late 30s, maybe. She had babies a little bit older. And after she had her second child, she was having a lot of problems, back pain, hip pain. She was having pelvic pain. She was having urinary incontinence. After her second child, she was active duty military. She couldn't do, you know, with active duty people, they have to do these physical performance tests that they have to complete in order to stay within what's required of them. So she was very nervous because she couldn't do any of that. And she was afraid that she'd get kicked out of the military because she couldn't complete these PT tests. And so when she came to see me, I mean, she could barely take care of her kids. She can only do a sitting job. She had so much pain walking, bending. and we worked together 3 months before I moved away. And by the time that I left, she was jogging. And to me, what made me so happy is because she felt like, I'm not going to get kicked out of the military. I'm going to be able to do what I'm supposed to and keep my job, because she really wanted to move up, you know, in her promotions. But the unfortunate part is if she couldn't be physically active and do the things that were required, she couldn't stay in. And that was my most recent. I was so proud because when she was going through all her testing, you know, they do MRIs and X-rays, and they told her, I'm sorry, ma'am, I don't think you're ever going to run again. I think they're going to profile you. They're probably going to kick you out. These are the doctors, the orthopedists telling her this, because they discovered she had hip dysplasia. That's a condition where the ball of your femur is too big and it doesn't stay in your socket. And, you know, and her, the pubic bone wasn't very stable. And I just told her, you know, you have to stay positive. I'm like, I know what they're telling you, but you just have to have faith and you have to stay positive, and I'm going to do everything possible. And I kid you not, she really did. She really did. She stayed positive. I said, don't let anyone bring you down. I'm not going to be unrealistic. Let's just take it a step at a time. And she did. And she did amazing. So that's my most current big one, because that was one that she would come crying. She felt defeated. And I spent a lot of time just trying to get her positive and getting her into have faith and just trusting. And then I kid you not, she got there. I was so proud. I was so happy. But she was a hard worker and she did everything I asked and more. And I just felt very happy with that success. And that was my most recent one that I felt really good about. That's when I realized this is why I still work. I'm getting older and I'm still working. I love to see this. I love helping people, and I love, you know, seeing the change. You see someone broken and then leave it, then they're put together and they're like a new person. And it's the most amazing feeling in the world. It makes me so happy and it makes everything worthwhile.
I know that's right. You ain't never lied. I ain't mad at you. You done told the whole truth. I mean, all it takes is a good case, and it'll remind you why I took this job anyway. You know what I mean?
Yes.
And or some kind of victory or triumph. It you know, even the tough ones sometimes make you want to still do the job, because you say, no, we're gonna work together and we're gonna beat this thing, or we're gonna do better, or we're gonna make it or something. You know what I mean?
Yes, you know, it's building someone's confidence and their self-esteem. And, you know, making them, you know, believe in themselves. And I think that's a very important thing to do. Hi, Romathea.
Hi, Poopy.
I miss you.
My baby.
I miss you.
Oh, I knew she'd tune in. You know, you got to speak in the people live. You know what I mean? When you speak negative things or you tell them bad things, you know, you got to grab a scripture, grab a hold of something. I shall not die, but live to declare the works of the Lord. I mean, I almost died so many times and had all kind of experiences in life, but I thank God I'm still here at 58 years old and I'm interviewing you.
That's amazing. And that, you know, and that's amazing that you're doing that, because you're helping so many people listening to your story. And if they encounter a bad situation, they just have to, would keep them going. I got to stay positive, because that can be me as well.
Amen. Amen. Now, flip side, what is your hardest or, you know, backbreaking story or that you might have had to deal with, and you might have had to call some colleagues to help you with it, or you only can get them but so far? It wasn't as far as you wanted it, but it was somewhere.
Well, that's happened too, and I've had to do that. I've had cases that are very, very difficult. You know, one of the conditions I treat quite a bit with my specialty with pelvic health, I treat patients with chronic pelvic pain. So patients with chronic pelvic pain, you know, it can be very difficult for them, because it's not just the pain, but there's also some mental health issues, you know, depression, anxiety. There's a lot of other things that come with that. And so sometimes when I encounter that, I try to do the best I can, but then sometimes it's more than my expertise. So I have to call in some help from maybe some colleagues, not necessarily just physical therapists, but perhaps like a psychologist, you know, their physician, a specialist, to work together to try to help this person. And because sometimes, I mean, it goes beyond what I can do. I try to stay positive and try to do that. But sometimes, especially if someone has quite a bit of depression, there's more to that and they need a little help. So it's trying to encourage someone that being sad is okay, but I think it's important to try to get some help. And I think those are the ones where sometimes to me, those issues are where it gets a little bit more challenging. It's straightforward if it's just like, okay, that's back pain, this is the issue, or just hip pain, this is the issue, it's muscle and bones. But I think for me, what gets more challenging is when it's very complex and it's just not that, there's more to it than that. And I think that's when I start calling in and start talking to other providers to work as a team to help this individual.
Wow. Amen. That's all right. Well, do you think we missed anything? Because I would like to ask you, who would you give a shout out to? And if somebody wanted to be a physical therapist like you, what sweet, understanding, encouraging word of advice could you give them out there? You know, because some people don't know that maybe they're in the wrong career, or maybe they might take it a step further. But whatever it is, what words, what food of wisdom can you give them?
Well, I always, so a little bit of my history too is I teach as well. And part of me is developing people, developing other clinicians. And so people that are interested in physical therapy, I tell them it's an absolutely amazing profession. I've been doing it for 24 years. I love it. I'm still working because I love doing what I do. I love learning. I love understanding things. And so what I tell people is, you know, it's if you like working with people one-on-one and you like to help people, this is an amazing career to do that. To come in and see someone come in one way and leave and the light is back in their eyes and they feel revived is the most amazing experience ever. And then especially in my career with my specialty pelvic health, I actually work really hard recruiting physical therapists to become specialists in pelvic health because it's an amazing career as well and a specialty, and there's so many people that need you. So I think what's more important is you have to care and you have to want to help people. Those are, you know, you don't have to be the smartest person in the world. You just have to want to care and and do the best for individuals. So better.
Very well said. Wow. Very well said.
I like that. That's what you do, Lisa. That's what you do. You help people. So
I'm trying. I'm working on it. To God be the total glory. Now, who would you give a shout out to? Who's out there that you want to give one of them shout out to?
Anybody?
Anybody.
Actually, you know what? Desire. I would give a shout out to Romathea because she helped me. Her knowledge was amazing. And I learned a lot from her. This last 6 months, like just getting to know her, shout out to you, Romathea. She was a little wealth of knowledge. She was like a little encyclopedia for me. Ooh, and I would like to give her a shout out because she made a big difference in my life this last 6 months. So I'm very happy. And look, I'm on the Lisa Baxter show.
You better go ahead. I ain't mad at you. Come on here. Come on here. You know, but do you have a website or anything, any awards or medals or anything that you want to show? You know, 'cause I know you just moved. So
I just moved, so I haven't. So every time I move, I start all over. So I'm just about to start all over. In terms of awards or anything, I mean, I just have like career-wise specialties. You know, like I said, I'm a board orthopedic certified specialist. I'm a pelvic health specialist. I'm actually back in school right now. I'm working on my doctorate. Beautiful. So that's what I'm doing right now. And then I'm going to just start building my program here in my new location. And so that's when I'll finally have my website and get started again on that. So I'm sort of recreating myself, which I have to do that about every 2 or 3 years. So recreate again.
Well, that's all right. Florida is in the house.
Asking, I appreciate that for sure. Thank you.
Oh, well, you're welcome. You're welcome. So, okay. I guess I'll thank you for coming on and giving us a wealth of knowledge and some gold nuggets and some coins. you know, and, you know, some jewels. We appreciate you very much.
Yeah.
Keep up the great work. Keep doing your thing. My best to your husband. Tell him, you know, and stuff like that. And have a great night.
Thank you. So
have a show next at 9 o'clock. Mm-hmm.
Okay, sounds good. Well, don't stop moving, everybody. Keep moving. Don't stop moving. Keep moving. It's the most important thing.
we trying, you know. And next time we'll drag some of your equipment in some of there or something. I'm just kidding. Don't pay me any mind. Yeah, no, don't pay me any attention. But thank you once again, and I appreciate you. You have a fantabulous, wonderful night. God bless. You. A billion blessings.
Good night, everybody.
Okay. Thank you. Woo! Was that a show or was that a show? And I took you on a ride in a short, quick way, didn't I, though? Yes, I did. The question for tonight is, why is it you should have to go to dialysis 3 times a week? And what are the lists for a transplant? What are the type of different lists that you can be on for a transplant? Put it in the comment box. So comment. Sharing is caring. Share this show, make it viral. And thank you for supporting me in every way that you did. V for victory. A billion blessings. See you next week with another great show. Bless your life and good night. Mwah!
Y'all ready for this? Yeah. This is the Lisa Baxter Show, giving you the 411 and the kidney one. My girl, and say, this is